We would like to acknowledge people with lived experience of disability. We would like to acknowledge the important support of their families, carers, disability services, and advocates. We respectfully acknowledge the First Nations as the original inhabitants of the nation and the traditional custodians of the land, oceans, and waters on which we live, work, and play. We pay respect to the First Nations and their elders past, present, and emerging, always was and always will be. This short video will first discuss accessibility services and reasonable adjustments, then the legal obligations around accessibility to services, and then making reasonable adjustments to create an inclusive healthcare. According to SPIDER's foundational report, accessibility of services has been one of the main challenging issues for not only family and carers, but also health professionals. Why is this a problem? First, patients have a right to access to medical services on an equal basis to others in the community. Secondly, they are at high risk of poor health outcomes, chronic disease, and premature death. Reasonable adjustments means changing an existing approach to a person's access to service. As a health professional, you are responsible for ensuring service accessibility. Remember that patients have a right to reasonable adjustments when they see you. Making reasonable adjustment for a person's disability creates an inclusive environment. Under federal and state legislation, reasonable adjustments are required. This is explained as avoiding indirect or direct discrimination in the federal legislation, specifically Section 5.2 and Section 6.2 of the Disability Discrimination Act. This is repeated under state legislation, specifically Section 45 of the Equal Opportunity Act. This states that service providers must make reasonable adjustments. It also describes what exactly is considered a reasonable adjustment. So it depends on the relevant facts and circumstances, such as the current nature of the patient's intellectual disability and the adjustment itself. You also need to consider how exactly the adjustment will affect you financially and the consequences if you do or do not make the adjustment. Under the National Safety and Quality Health Service Standards, there are 4 steps that use reasonable adjustments to create an inclusive healthcare. The aims of the standards are to protect the public from harm and to improve the quality of health services. The first step is plan. So the plan stage is basically pre-appointment considerations. Are communication aids required, such as easy read or a pictorial format? Would there need to be more physical space? And do they need assistance from other health staff? So the second stage is understand. Think of it as holistic learning. So you want to learn about their intellectual disability, the patient's goals and preferences before deciding on their treatment. So here, the third stage is communicate. The purpose is to form a connection with your patient. So here you want to communicate directly with your patient rather than their support person. You also want to ask questions. Asking questions in different ways a few times can show that you're both listening and showing understanding in the matter. Asking detailed questions can show that you're trying to get the whole story. At the end of the day, patients are people with different needs, and to understand each other, questions are an important part of the process. You can also use different approaches to communication, such as simple language, easy read English, and visual aids. So the fourth stage is ACT. This is about being proactive. You want to screen for the patient's mental health, You also want to follow up on their test results and any health issues. Then you also want to prepare the patient and the support person for the next steps, such as referrals or hospital admissions. Remember, you are part of the patient's primary healthcare team. This means you are one of the first point of contact patients would have with the health system. So this means as a health professional, you are responsible for ensuring service accessibility. Remember that patients have a right to reasonable adjustments when they see you. Making reasonable adjustments for a person's disability creates an inclusive environment. Thank you for watching this video. Please see the description for the links to other resources.